Hello, we'll be dealing with a topic called Clavi pectoral fascia. As the name indicates, Clavi pectoral fascia, that means a fascia which is stretching below the clavicle and pectoralis minor. So this is the fascia which is present over here. This one is the Clavi pectoral fascia. I repeat, the fascia stretching between the clavicle and pectoralis minor muscle is clavipectoral fascia. Medially, this clavipectoral fascia blends with the anterior intercostal membrane of upper two spaces. That means between first and second and third ribs. Medially, you find the anterior intercostal membrane or external intercostal membrane. So, the medially, this fascia is blending with that. Medially. Laterally, it is blending with this coracoid process of scapula. The medial extent of clavipectoral fascia is anterior intercostal membrane of upper two spaces. Laterally, its extent is till coracoid process. Superiorly, below the clavicle, it splits into two. Here, if you see this clavipectoral fascia, superiorly it is splitting into two to enclose a muscle called subclavius, and the two lips are attached respectively to the anterior and posterior lip of the subclavian groove of inferior surface of clavicle. From the posterior lip, an extension which blends with the axillary sheath upwards is seen anchoring the inferior belly of omohyoid muscle. Okay. The portion of this clavipectoral fascia between the coracoid process and first costochondral junction here, this portion gets thickened. This portion gets thickened and is formed or converted into a ligament called costocoracoid ligament. The portion of clavipectoral fascia below that passes downwards, splits to enclose the muscle here. This is the pectoralis minor muscle. After enclosing, it reunites, forms the suspensory ligament of axilla and blends or gets attached to the summit of the axillary fascia, thus maintaining the hollowness of the armpit. I repeat, clavipectoral fascia boundaries medially anterior intercostal membrane of upper two spaces, laterally coracoid process, superiorly splits to enclose subclavius, inferiorly splits to enclose pectoralis minor and forms the suspensory ligament of axilla. Now coming to the structures piercing the clavipectoral fascia, this one. Structures piercing the clavipectoral fascia, our clavipectoral fascia is here. What are the structures which are piercing? Number one, cephalic vein. Number one is cephalic vein, which finally opens into the axillary vein. Number two, this one, lateral pectoral nerve, which is a branch of lateral cord of brachial plexus. This is a lateral cord, already it is written here, lateral cord. So the lateral cord of the brachial plexus, lateral pectoral nerve. Number three, thoracoacromial artery, which is a branch of the axillary artery. Number four, the lymph vessels draining the lymph from the apical group of lymph nodes. These are the lymph vessels. So these are the four structures which is piercing the clavipectoral fascia. I repeat, cephalic vein, lateral pectoral nerve, thoracoacromial artery and lymph vessels. This is all about the clavipectoral fascia. Thank you.